Hey, it's Dr. Brian. I wanted to just talk a little bit today about medications. And actually, that photo on my desk is one of the things that I do regularly. I want to see pill bottles. I want to see what medications do you actually have at home? Who else has maybe prescribed something that was not discoverable in the electronic health record? Do I see empty pill bottles before they should be, or do I see pill bottles that are still full, even though they should be consumed? This is all important information. Oftentimes, when I admit a patient to the hospital and I go through their medications, I ask them what medications they're taking. Maybe I have an outdated list or I see information in the computer. And oftentimes, what I'll hear is, it's in my chart. Just look at my chart. Lots of mistakes happen. People, instead of hitting 5, can hit 50 and create medication errors that way. Or I see duplicate prescriptions. One of the other favorite things that I hear is oftentimes a family will tell me, or a patient will tell me, I take that little white round pill. I don't know if that's an allergy medication, heart medication, if that's a medication to help treat anxiety or depression. And so, while yes, I sometimes joke, I only prescribe them, I don't take them, the serious issue is that medication mistakes can actually have significant impacts and can actually harm and kill people. When you go into the hospital or come out of the hospital or establish care with a new doctor, one of the most important things a mentor taught me was have all pill bottles brought in. I see people sometimes bring in 2 bags of pills that span years. I have found other family members' pills in the pill bottles. I have found cat and dog prescriptions in those bags when they come in. And it's a really important opportunity for us as physicians to actually sit down with patients. The healthcare system is challenging. Medications are challenging, they're confusing. And this is where having a physician to actually take the time to look at all of your medications and to really help you understand what those medications are and why you're taking them. Or if you've gone into the hospital and they've changed there, it's important that the physician in charge of your care, as well as you, know what those medicines are and how you can be protected against medication mistakes. That's an essential part of my practice here at B2 Direct Care. I look forward for you joining my practice. When you do, I will probably ask you to bring in your bag of pills so that we can go through them and that I can learn about your medicines that you've been taking, maybe why you don't like taking medications, and more importantly, so that you are aware of the medications that you have been prescribed and the medications that you will be taking. So don't be offended if the first visit I say, bring me all your pill bottles. It's not judgmental. It's actually a really important way for me to get to know your medical history. And guess what? If you don't have any medications or you just take occasional over the counter medications, that's awesome. We'll talk about that as well. Life changes. People who are on no meds can suddenly find themselves on a handful of meds after a serious medical illness. So I look forward. Join me, follow along, and we'll get to know each other